Welcome to Connectivity Without Chaos, the podcast for IT leaders who are done managing networks by guesswork. In each episode, we break down the systems, strategies, and decisions that eliminate the hidden IT tax, so your infrastructure becomes reliable, secure, and built to scale. Today, we discuss why One Health system redefined its wireless foundation across 15.7 million square feet.
And, the sheer scale of this project is it's massive.
Yeah, it really is. So our mission for you on this deep dive is to explore exactly how Provision Networks prepared this huge nonprofit health system for next-generation clinical mobility and digital care. I mean, we're looking at 27 hospitals within a multi-state system.
Right, and over 30 growing facilities overall. It's a staggering footprint, like 60,000 employees all relying on this one network.
Exactly. And the immediate catalyst here was an upcoming CareAware Connect deployment. It is basically like trying to rewire an entire city's power grid, without ever actually turning off the electricity.
That is a perfect analogy, yeah. Because CareAware Connect, it is not just occasional web browsing. It is continuous data streaming. You are talking about secure texting, barcode medication administration, clinical voice over IP calls.
All of that competing for airtime alongside heavy Epic usage, right?
Right, exactly. The health system's leadership realized their legacy setup it wasn't engineered for that kind of persistent real-time load. And here's the core philosophy Provision brings to this. Hospitals don't buy Wi-Fi.
Right. They're buying epic performance and nurse productivity.
Yes, workflow automation, patient experience. If that invisible grid fails, the life-saving tools fail. So infrastructure readiness is really the true foundation of healthcare.
So sticking with that city grid metaphor, if you can't turn off the power to test it, how do you actually map a 15 million square foot grid without just guessing, especially with thousands of moving bodies and machines?
Well, you assess and analyze. They rely on rigorous passive RF surveys and predictive designs. Provision didn't just, walk the halls looking at where access points were mounted.
They actually measured how the radio frequencies behave in the space.
Yeah, physically in the space. Because a lead-lined radiology wall absorbs and reflects signal very differently than, a standard drywall partition in a waiting room. They were mapping the physics of the environment to calculate signal attenuation and find dead zones before a single new cable was pulled.
Okay, but predictive designs are fundamentally just software models. A model might look great on a screen, but what happens when 50 heavy mobile medical carts are shoved into a single hallway during a code?
Right, and that unpredictable client density is exactly why they conducted deep roaming and capacity analysis alongside those static models. It is one thing to have basic signal coverage.
But ensuring a clinician's device can seamlessly hand off between access points while they are sprinting down a corridor is totally different.
Precisely. Provision's engineers were effectively doing seismic testing on the ground before laying the foundation, ensuring it could handle sudden shifts in client density without dropping a critical VoIP packet. But there's another layer to this that is really fascinating.
Oh, wait, you mean the RTLS stuff? Because I saw that in the sources and it confused me. They were mapping out future asset tracking, like where wheelchairs and IV pumps will be, before they even fix the immediate communications network.
Yeah, they were. And it sounds kind of backward, right? How do you justify that to medical staff who might just be frustrated that their tablets are disconnecting today?
Exactly, fix the tablets first.
Well, you have to look at how location services alter the RF landscape. Asset tracking involves thousands of battery-operated tags constantly chirping out their location.
Oh, so that raises the overall noise floor of the network.
Significantly. If you only design for today's tablet usage, the moment you turn on that RTLS system next year, the interference spikes. And suddenly that tablet drops offline during patient care. Evaluating RTLS readiness upfront provides enterprise visibility.
Okay. So identifying those capacity limits now is what actually eliminates the deployment risk for future technologies. Mapping the future state isn't a distraction. It's the only way to ensure the current rollout doesn't collapse later.
Exactly. It moves the organization from reactive troubleshooting to foundational engineering. The result of this entire engagement was an executive WLAN modernization roadmap with highly repeatable engineering standards.
Giving system leadership absolute confidence, right? Because they traded guesswork for a validated future-ready foundation.
Yeah, a foundation that can scale seamlessly across all 30+ of their growing facilities.
And consider how much of a hospital's future life-saving potential relies entirely on that perfectly mapped, invisible foundation of radio frequencies. I mean, think about the next frontier.
Oh, for sure.
Continuous biometric wearables on every single patient, or AI-driven diagnostic tools streaming ultra-high-definition imaging in real time. The hospitals that survive that incoming data tsunami will be the ones that perfectly map their grid today.
Could not agree more.
If you found this helpful, subscribe to Connectivity Without Chaos on Substack for more insights on eliminating the hidden IT tax. And if you're dealing with a connectivity or infrastructure challenge, send it our way. We may cover it in an upcoming episode.